Hello. It's a very novel report that came in the newspaper about Ayurvedic treatment going on in Andhra Pradesh. So you can read the title here. Hundreds, including COVID suspects, queue up at Andhra village for Ayurvedic treatment of virus. I do not know how many of you have heard about this. People in very large numbers gather at Krishnapatnam village in Nellore district, where an Ayurvedic practitioner is distributing medicine for COVID-19. Social distancing norms flouted because the crowd is so large. And as India fights the second wave of deadly coronavirus, an Ayurvedic quack in Nellore, Andhra Pradesh has been distributing herbal medicine and eye drops, which have been drawing huge crowds of both COVID and non-COVID patients. You know, when I listened to the reporter in the print, she said that whether people, the person who responded to that, he said the people with COVID, even people who may suspect or may think that they may get COVID, all are coming for treatment over there. So that is a huge thing that is happening in Andhra Pradesh. So I'm trying to take out that part and coming to this. Andhra Pradesh government permits usage of Anandaya herbal medicine for COVID patients. So I had another day the report in Tamil Nadu that when Stalin, Chief Minister, wanted to open some Siddha Vaidya clinics, there was objection not from the government side but from the medical association side. Whereas here, Andhra Pradesh Chief Minister, who is supposed to be a very firm believer, Christian, and he has given permission. The eye drops are yet to be approved. The state government on Monday permitted the usage of the herbal concoction being given to COVID-19 patients by the Anandaya of Krishnapatnam in Nellore district. By taking into account the findings of the Central Council for Research in Ayurvedic Sciences that kept on hold its decision on the eye drops claimed to be life-saving for those with dangerously low levels of oxygen. That's something really strange, is it not? Taking eye drops, how it's really working inside. So how God has created the body, and so many different ways. How, when I used to talk about the church as a physical body, if one member suffers, the word of God says, all the members suffer. So I think our body parts are so interconnected. Now this concoction has got ingredients like honey, pepper, green camphor, nutmeg, black cumin, cinnamon, and medicinal herbs. They are not harmful for the body. That is why his medicine has been allowed to be used. He was a practitioner, Mr. Anandaya was a practitioner of Ayurveda for more than 30 years. And he's not such a qualified person, but he was a practitioner of Ayurvedic medicine, which naturally brings this treatment as success. So coming to another thing is that, sorry, this one I had shown. I should have gone to this. Yeah, this is another title with the News 18. India, AP government gives not to use traditional medicine prepared by Ayurvedic practitioner. This is the same repetition of the news from another newspaper. That's why just I'm showing two clips so that you know that it's the truth that is happening. The COVID lockdown is extended to June 10th. Government's Baba's cure. This is the Chief Minister of Andhra Pradesh, and, who is a firm believer in God. And when he says that if these things are bringing down cure, let the people uh, receive the cure, treatment. That's what he has allowed it to happen. Now, controversially, the other things that's happening in the other state, in Gujarat, you see, this is supposed to be our Prime Minister's home state. So it says like this here: the death count is how journalists in Narendra Modi's home state exposed India COVID-19 deception. I don't want to say much on this because I don't want to bring a controversial report about the state of Gujarat. But what I want to mention is there were some reports which had been coming out about Northeast India. So, government responsible person says there is no COVID and there are COVID-free villages in the states, whereas I have my people working over there. I talk to them periodically, and I came to know that there are COVID cases in northeastern states. Similarly, although there are many claims about the Gujarat model and how Modi had been behind this developing of Gujarat for the first 15 years when he was a chief minister. But there's a remark here: the health minister had questioned long back that there are no hospitals, enough hospitals, and there is no healthcare system in Gujarat. See, over the past few years, the state's healthcare budget has dipped. There are just 75 hospital beds per 100,000 citizens, whereas the national average is 118 per 100,000 citizens. So have a worrying shortage of doctors, and the deaths that are reported are very minimal, whereas the crematorium or burning places are being prepared for such a massive statistics showing that several deaths have taken place. This is another great scene in front of a huge hospital, how the patients are waiting outside in Ahmedabad. This is another place. So there are controversial reports, beloved, and we need to continue to pray that treatment is available for everyone so that they receive, whether it is vaccination or medicines or even Ayurvedic treatment. Let it bring healing and let it bring relief for the population in India. God bless India.